Hello friends, welcome back to my channel The Medical Stores. So our today's topic is going to be alpha-1 antitrypsin deficiency. So let's get started. We have alpha-1 antitrypsin enzyme which helps to protect our lungs. So you have to just remember that alpha-1 antitrypsin is an enzyme which protects our lungs from the destructive property of the protease enzymes. What are the protease enzymes? These protease enzymes are like neutrophilic elastase. Like they have the function, their function is to destroy the proteins. Okay, so the antitrypsin is an enzyme which inhibits the activity of the protease enzymes. So which is, I guess it is clear in short, antitrypsin is the enzyme which inhibits the activity of protease enzymes, and in turn it protects our lungs. Now where is the antitrypsin is found in our body? Okay, so this enzyme is prepared, it is found in liver, it is formed in liver, and through liver it goes to the blood, and through blood it goes to the lungs, where it does its function of protecting our lungs. So here are some notes which is made by me. So we will just review from this. So alpha-1 antitrypsin deficiency, it is a congenital lack of primary lung antiprotease alpha-1 antitrypsin which leads to increased protease mediated tissue damage and emphysema in adult. So this is basically which I have explained you in short at the start of this video. So the enzyme is formed in the liver, alpha-1 antitrypsin, and through this it goes into blood, and from the blood it can goes into the lungs. Congenital lack of this enzyme alpha-1 antitrypsin, so what can it lead to? So if the enzyme is formed, like in liver the enzyme is formed, but it does not progress, like it does not go due to some congenital defect, so there will be no enzyme in the blood, no enzyme in the lungs. So the lungs will be favorable for the protease enzymes, so they will easily damage the lungs. And as this enzyme is formed in the liver, but it gets accumulated in the liver, so it will lead to the liver disease. So we will get two type of organ which will be affected by this enzyme deficiency. The first one is the liver due to the accumulation of alpha-1 antitrypsin, and the second one is the lung. Why? Because the alpha-1 antitrypsin enzyme does not go to the lungs, so the lungs are exposed for the protease enzymes to be easily destroyed by those enzymes. So now I will explain the pathophysiology. If there is deficiency of alpha-1 antitrypsin enzyme, so that will lead the neutrophil elastase. What is neutrophil elastase? It is one of the protease enzymes. So this neutrophil elastase is free to damage the lungs. It will go and damage the lungs. And the alpha-1 antitrypsin, as I have explained, that its function is to protect the lung from the neutrophil elastase. So you need to remember this enzyme neutrophil elastase, which has the maximum ability to destroy the lungs, and it is a type of protease enzyme. Okay, so now we will see that how does this enzyme deficiency can affect the liver and the lungs. So in the liver, the alpha-1 antitrypsin can cause conformation change or liquid, which will lead to the retention within the hepatocytes. Accumulation of alpha-1 antitrypsin. So as we have seen that it is a congenital defect, so in neonates it can cause cholecystitic jaundice. It will give signs and symptoms of jaundice, and 20% cirrhosis in childhood, and 10% of cirrhosis we will see in adult, and there is also a risk of liver cancer. Okay, now in the lungs, we have seen that alpha-1 antitrypsin is needed to protect our lungs. But if the alpha-1 antitrypsin is not there in the lungs due to deficiency, so the activity of the neutrophil elastase increases, facilitates tissue destruction, which will lead to emphysema, and if they are smokers, increased risk, and 1 to 2% can lead to COPD. Okay, so the disease which we have seen now is in liver. It can cause jaundice, which would be neonates, cirrhosis, and it also has increased risk of liver cancer. In lungs, it can cause emphysema, COPD, and chronic bronchitis. The C stands for chronic bronchitis. Sorry for this. And there are also few diseases which can be associated with alpha-1 antitrypsin deficiency. So these diseases can be paniculitis, life-threatening hemorrhage, aneurysm, ulcerative colitis, ANCA vasculitis. It is basically a disease of vessels, and glomerular disease. So it is not important to remember the association of this disease, but just to have an idea. So now what will be the signs and symptoms? So the signs and symptoms of the patient will be dyspnea, cough, we will hear wheezing or auscultation. There will be prolonged expiration. In neonates, we have seen it can cause jaundice. We can also see hepatomegaly, and we will see these symptoms in neonates in the first week of life. Okay, in the first week of life, and these conditions will lead 2 to 4 months to resolve, like 2 to 4 months of age to resolve this. And in child or adulthood, we will see cirrhosis and emphysema. Okay, now how can we diagnose? What are the diagnosis tests for this disease? So diagnosis we can do by checking, simple, it's easy. We can check the serum alpha-1 antitrypsin level. Genotypic is it is nothing but to check genetics, like susceptibility for this enzyme deficiency. So how can we suspect that a particular patient, does he have the alpha-1 antitrypsin deficiency or not? Because as we have seen, the signs and symptoms are similar to any other disease. So how we can suspect? So just to suspect, we have to remember these few points. If he is a smoker, he will get emphysema and his age must be below 45. And if he is a non-smoker, he will still get emphysema and is no exposure to anything. Then chest x-ray. In chest x-ray, we will see lower lung emphysema and family history. If a person is having family history of emphysema, cirrhosis, so yes, we can suspect, like, yeah, they may have, because we also check the genotyping. And as you remember, this disease is a congenital disease, so it can be hereditary. And also in patients, the P is for the patient with pancreatitis. And neonates will, if neonate is having jaundice, increased liver enzymes, so you should check for this level of this enzyme. This is the easy way to diagnose, just check the serum level of this enzyme. So basically the best thing to diagnose this is just check the serum alpha-1 antitrypsin level. You will get your diagnosis easily. So yes, the level. So to check for it, you should know the normal level. So normal level of this enzyme is 100 to 300 milligram per deciliter. And when you will suspect the disease, if it is less than 80 milligram per deciliter, then you can suspect that, yes, can diagnose that, yes, this person is having deficiency of alpha-1 antitrypsin. Okay, and this value is, I have just given in micromole. Like sometimes the examiner can give these values in mg or in this unit, so remember the both. So now we will see the treatment. So like clearly you can see, if a person is having a deficiency of one enzyme, so what will the treatment? Yes, we will give that enzyme through IV. So we can give alpha-1 antitrypsin through IV, 60 mg per kg we can give over 45 to 60 minutes 1 per week, or we can give 250 mg per kg, 1 per month. And yes, if a person gets emphysema, it cannot be repaired. We cannot repair emphysema, but yes, you can just halt the progress, that you can just stop the progress. And if your patient is a smoker, so you have to tell your patient to just quit the smoking. And you can also give bronchodilators, you can also give phenyl butyric acid. This basically it is not used now, but it was just given, so it reverses misfolding of the alpha-1 antitrypsin in liver. So but this drug is not used nowadays. And if there is a severe problem, like if the lungs are severely damaged due to the action of the protease enzyme, and if the liver are severely affected through the accumulation of this enzyme, like cirrhosis, so there may be a need to transplant lung and the liver. Okay, so our today's topic was alpha-1 antitrypsin deficiency. I hope you understand it, and see you in my next video. Thank you.